Bismillahirrahmanirrahim. Assalamu alaikum. This is me Shamala Kadir conducting your course 518. Students, in the previous lecture, we covered what are resins, their physical properties, their chemical properties, and different type of classifications of resins. Today we will start the resin containing drugs. So the first drug we have cannabis, which is also called Indian hemp, ganja, marijuana, and it is the dried flowering tops of cultivated female plants of Cannabis sativa family, Cannabinaceae. It has the hypnotic constants and it is also the drug of abuse. The chemical constituents present include, when we talk about the resin, so it is 15 to 20%, and it has the major active principle, that is 1,3,4 tetrahydroxycannabinol, which is basically the hypnotic constituent. It also has cannabinol, cannabidiol, cannabidiolic acid, etc. And because of these chemical constituents, it is the drug of abuse. The medicinal marijuana is used as sedative, hypnotic, inducing sleep or deep sleep. It is narcotic analgesic, producing analgesic activity against intense pain. It also has antibacterial activity and it has psychotropic properties because of having this 1,3,4 tetrahydrocannabinol. And this is the constituent which is making it as a sedative drug or hypnotic drug. So its use is restricted. The second drug we have Photofiber. It is also called methyl and metric, and its biological source. So it is the dried rhizome and root preparation of Photofiber resin, that is Photophylum peltatum or Photophylum imodi, that is Photophylum hazendrum, and belongs to the family Pyruvate. The resin or Photophylum resin is also called Photophyllin. And how it's prepared? The powder mixture of resin is extracted by percolation with alcohol, that is followed by precipitation of concentrated percolate with acidified water. Now the precipitated resin is washed with water twice and then dried and again powdered. The chemical constituent include resin, which is 3.5 to 6% and has active principles that are lignins, which include photophyllotoxin, that is about 20%, and also alpha peltatin and beta peltatin. Alpha peltatin is about 10% and beta peltatin is less, which is about 5%. A number of lignin glycosides are present, as I told you that as it is glycoresins containing drug. So the lignin glycosides, because of their water solubility, they are lost during the preparation of resins. The drug is used as purgative. The resin has effect against cancer cells because of its action as antimitotic and causative. It is also used as bitter tonic. The next drug we have Merc, also called gum merc. Its biological source is Chemifora molumul or Commiphora absinica and belongs to the family Perseraceae. It is oleogum resin which is obtained from the bark after incisions. As you can see in the figure, incisions on the bark, after the incision of the bark, the oleogum resin oozes out. Importantly, the odor of the myrrh is due to the presence of volatile oil because it is oleogum resins. So, as I told you, oleogum resins contain gum and volatile oils with resins, or it's a mixture of volatile oil, resins, and gum. So, because of this volatile oil and this volatile oil exhibiting its odor. So, the odor of myrrh is due to presence of volatile oil. The resins of this myrrh is composed of resin acids, that is alpha, beta, and gamma chemiphoric acid, and it also has resins, whereas the phenolic compounds include protocatachoic acid and pyruvate. It also has gum because it is oleogum resin, and gum that form mucilage and yield arabinose on hydrolysis is present. Now come to its applications. It is used as a protective and is also used as stimulant and stomachache, producing or enhancing appetite. It has astringent property and used in mouthwashes. The next drug we have Pyruvate, which is also called Peruvian balsam or balsam of Peru, and it is because of its origin, because it is obtained from Myroxylon pyruvate. It belongs to the family Leguminosae. And this resin is natural resin which is obtained from the exposed wood of trees of Myroxylon pyruvate. As far as the chemical portion are concerned, the major portion is cinnamon, which is a volatile oil, and it is accounts for about 60% of the drug. And it has a major portion that is benzyl cinnamate and a lesser portion of benzyl benzoate is present. Whereas resin esters are also present, that is account for 30 to 35% and are composed of pyroresinate cinnamate and benzoate. Whereas some other substances are also present which include vanillin, free cinnamic acid, pyrobiol, and some other substances. So the major portion is of volatile oil that is account for 60%, and after this resin esters are present that is account for 30 to 35%, and some other substances are also present in a small amount such as vanillin, free cinnamic acid, pyrobiol, and some other substances. The drug is used as protectant and lubrificant. It is also used in different skin-related disorders. It is also used as parasiticide in the skin, and it also has antiseptic property. And it can be applied alone or in alcoholic solution on the external surface of the body, and it is also used in the ointment preparation or it is used in the form of ointment. The next drug we have Tulu balsam, and it is also called balsam of Tulu. It is obtained from Myroxylon balsamum and it belongs to the same family as that of Pyrubalsam, Leguminosae, and it is obtained as natural resin by incising the bark and the sapwood of the tree of Myroxylon balsamum. As you can see in the picture also, that it is obtained by incising the bark and its extract form is also representing in the next figure. Now come to the some basic properties of the blue balsam. Its odor is representing the odor of vanilla, which is its chemical constituent. So it has aromatic, agreeable odor resembling to that of vanilla, and it has aromatic and slightly pungent taste. Chief chemical constituents include esters, which is chiefly contain toluresinol cinnamate, and also it has a small amount of benzoate. Volatile oils is present, which include benzyl benzoate, whereas free cinnamic acid and benzoic acid are also present. It also has vanillin, which is representing or exhibiting the aroma. So its aroma is because of presence of vanillin. It also has medicinal application. It is used as pharmaceutical aid for benzene tincture preparation. This tincture is used for topical application as protectant. And this tincture also has some other constituents such as aloe, storax. It is also a valuable expectorant. It has pungent flavoring used in medicinal syrup and in confectionery, in chewing gum, and in perfumery industries. The next drug we have benzone, which is also called gum benzoin, luban, sumbrani, lubana, sumartha benzoin, and it is obtained from the stem of Styrax benzoin, which is called sumartha benzoin, and Styrax tuncinensis, which is called benzoin, and it is obtained as natural resin by incising the stem of the Styrax benzoin or Styrax tuncinensis. These belong to the family Styraceae. The chemical constituent include about 23% of balsamic acid. It includes cinnamic acid and benzoic acid and also the ester of that. It contains 70 to 80% resins, which is consisting of triterpenoid, stearacinolic acid and sumaracinoic acid. Whereas it also has vanillin, sterol, phenyl propyl cinnamate, which is responsible for its aromatic smell. It is a wide range of applications. It is used as antiseptic. It is also used as a stimulant. It is used for respiratory problems, as expectorant, used as diuretic. It is also used in compound benzone tincture, which is used as topical protectant. This compound benzone tincture also has other constituents, which include aloe, storax, and tolu balsam. So students, today we have covered some resin containing drugs, and we will continue our topic in the next lecture. Thank you so much. Allah Hafiz. Take care.